What if I told you that just caring for your teeth could actually impact your blood sugar control almost as much as adding a new medication? Would you even believe that?
It sounds pretty dramatic,
It
doesn't it?
does.
Yeah.
But that's the kind of serious research we found with the team here at Oceanic Dental. And by the way, welcome back to the Oceanic Dental's Edit. Today, we're going to dive into this powerful and honestly often ignored connection, diabetes and oral health.
Yeah, it's definitely a two-way street.
Exactly. Not separate issues at all. They're more like dance partners. If one stumbles, say, your gum health or your blood sugar, the other one often follows right along.
That's a great way to put it. For so long, we just looked at, the mouth in isolation, but understanding this feedback loop is critical.
So that's our mission today.
Right. We'll simplify the science a bit, how uncontrolled glucose really creates, a perfect storm in your mouth, and crucially, how gum problems can then compromise your whole body's ability to manage sugar.
Okay, let's tackle the first direction then. How high blood sugar sabotages your mouth. The sources called it the Great Glucose Heist, which I thought was quite evocative.
It is.
So if your blood sugar is consistently high, that extra sugar shows up in your saliva too.
It does directly. And suddenly, you've basically laid out an all-you-can-eat buffet for all the bacteria that love to form plaque.
Okay. So more fuel for them, which means higher risk for cavities, obviously, and gum inflammation.
Precisely, but it gets worse. That high sugar doesn't just feed the bacteria, it actually weakens your own defenses at the same time.
How so?
Well, hyperglycemia, high blood sugar, it sort of handcuffs your immune system. Your white blood cells just don't work as effectively.
So if you do get an infection, like in your gums,
It's likely to be more severe, and your body struggles to heal it. Healing is much, much slower.
and on top of the immune issue, isn't dry mouth xerostomia also common?
Very common. And saliva is incredibly important. It's your mouth's natural defense system, washing away germs, neutralizing acids.
So less saliva means less protection.
Exactly. You lose that constant rinse cycle. And there's another factor on a microscopic level called the AG factor, advanced glycation end products. Basically, rogue sugar molecules sticking to proteins, damaging them.
Okay.
These AGEs build up in the gums, and they act as triggers for chronic inflammation, actively destroying gum tissue and even the bone underneath.
Wow. So the sugar literally helps break down the structure of your mouth. That's pretty intense.
It really is.
Okay, let's flip the script. How does poor oral health, like gum disease, fight back and mess with blood sugar control?
This is where that two-way street becomes really clear. Periodontitis that's chronic, deep gum infection isn't just a local mouth problem.
Right, it doesn't stay put.
No. The constant battle with bacteria down there, it triggers inflammation systemically throughout your whole body. It's like a low-grade fire alarm that's always on.
And that body-wide inflammation is the link.
That's the key. The systemic inflammation directly interferes with how your cells respond to insulin. It gums up the locks, you could say.
Making the cells resistant to insulin.
Exactly, insulin resistance.
Yeah.
Which, of course, makes blood sugar much, much harder to control.
And here's a statistic that really made me sit up. Treating moderate to severe gum disease can actually lower HbA1c levels. That's your average blood sugar marker. By about 0.4%. That's significant.
It absolutely is. Clinically meaningful. It's comparable to the effect you might get from adding a second oral diabetes medication, just from treating your gums.
Which really drives home the warning sign, doesn't it? Bleeding gums.
Absolutely critical. Bleeding when you brush or floss is never normal. Never.
And if you have diabetes, that bleeding isn't just a sign of gum trouble.
It's a red flag. It means there's a chronic inflammatory burden actively fighting against your efforts to control your blood sugar.
So, given how quickly things can apparently change, the standard 6-month dental visit might not cut it.
Often, no. For people managing diabetes, the recommendation is frequently cleanings and exams every 3, maybe 4 months. It's about catching inflammation early.
Staying ahead of it.
Yes. And we really need to bust that myth, the idea that diabetes means you're just destined to lose your teeth.
That's completely false, right?
Yeah, utterly false. Good blood sugar control is hugely protective. And even things like dental implants, they have very high success rates, over 90%, in patients with stable glucose levels.
So the takeaway here seems crystal clear. Taking care of your gums isn't just about, having a nice smile.
Not at all.
It's a medical necessity.
Yeah.
It's fundamentally linked, hardwired into managing diabetes effectively.
It truly is. And it leads to a broader thought, doesn't it? If something as seemingly straightforward as good dental hygiene can potentially offer benefits similar to a medication,
Yeah.
well, what other small daily health habits might you be underestimating? Think about your own routine. Is your oral care truly supporting your bigger health goals right now? Something to consider.